There are certain basic requirements that are needed. You have to be between the ages of 17 to 60. You must weigh at least 110 pounds or above. And at the time of donation, you should be in good health in terms of not having any communicable diseases like flu or other transmissible diseases. Main obvious reason is that you are going to save lives. As of yet, not all blood components can be actually manufactured artificially, so there's nothing like blood. It then helps along with people who have cancers, involved in motor vehicle accidents with blood loss, and also in children who have had certain illnesses or they themselves have been involved in motor vehicle accidents or traumatic injuries. It's also beneficial to people who have certain diseases like hemophilia, where they need to replace some of those components that they're actually deficient in. First and foremost, the altruistic benefits of having given blood that will help to save people's lives. Two, they actually get like a mini physical exam at the time of donation of blood, where their hemoglobin levels are checked, the blood pressure and pulse rate, as well as other vital signs. And the blood samples that are taken off with the donation of the blood is sent back to the labs to have certain tests like HTLV1, HIV, syphilis, and other transmissible diseases tested for. The other benefits too is like with men who are at a higher risk of getting hemochromatosis, but by donating the blood, it actually decreases what you call the iron overload that tends to occur. And it also stimulates the bone marrow in all people who donate blood, because when you donate a pint of blood, you actually drop your blood count, and it then stimulates the bone marrow to reproduce these cells over time. It helps saving lives with the recipient, and as I said before, there's no substitute for blood artificially as yet with all of the components. And depending on the requirements, because blood itself can be separated into three main different components: the blood itself, plasma, and they have other what you call bleeding or clotting factor. And depending on the ailment or the injuries that the person have, they would need either one or all of these components. Follow some simple procedures whereby you should have a full meal within 3 hours of the time period of donating blood. Have a good night's rest. You need to be well hydrated in terms of drinking a lot of fluids before and during and after the donation of the blood samples. And if you're hypertensive or diabetic, make sure you take all your medications, including on the morning of donation, so that your vitals are well within the normal limits. And no smoking for at least 72 hours before donating the blood if you're a smoker.